drink mixtures is taking a serious toll on the communities. Many users are engaging in risky combinations of substances, increasing the likelihood of severe health complications. According to Dr. Johnson Bitungwa of Kavale Regional Referral Hospital, the situation there is becoming increasingly alarming, with substance abuse now over a major contributing factor to the mental health cases in that region. Hospitals record over 1,300 mental health patients in 2025 alone, with a significant number of cases linked directly to alcohol use. Experts say that the crisis is being driven by deeper social challenges, increasing stress, unemployment, depression, and domestic instability, pushing many young men towards substance use and as a coping mechanism. However, this often worsens their conditions, leading to the addictions and escalating family conflicts. Health officials are now calling for urgent action, including strict regulation of harmful substances and stronger community awareness campaigns, warning that without intervention, the impact of public health and social stability could intensify. Now, moving on to our next story, UPDF medical outreach draws massive trail and turnout in Bulambali district. Hundreds of residents in Bulambali district have turned up for free medical services under the UPDF Okelo Masia 26 exercises, highlighting that there is a growing public trust in the military role beyond security. And the outreach has been led by the Uganda Police Defence Forces and is offering a wide range of services, from general treatment to specialized care at Bujiyanyanjo Narrow Agricultural Farm and Muyembe Health Center 4. According to General Ernest Nuwagaba, the strong turnout reflects that confidence in the army community supports the efforts. He noted that the initiative is part of the UPDF's commitment to giving back and also strengthening ties with the civilians. Medical teams on the ground are handling various conditions, including minor surgeries, tuberculosis, and also cancer scanning and screening. Also eye and dental care, as well as maternal health services. There are also more complex cases being managed at Muyembe Health Center 4. The exercise, which began on April 12, 2026, brings together multiple agencies, including the Ministry of Health, Uganda Police, and also the Uganda Red Cross, to not only provide care but also strengthen disaster response and also emergency preparedness. Health officials say that the outreach is already making a significant impact, improving access to the essential services while reinforcing collaboration between security forces and the communities they serve. Moving on to our next story, school outreach boosts child immunization in Kayunga district. Health authorities in Kayunga district are stepping up with efforts to improve child immunization through school-based outreach services as part of intensified integrated child health days. Officials say that taking services directly to schools, markets, and also communities is helping to close the long-standing immunization gaps, especially among children who previously missed the routine vaccinations due to the distance, misinformation, or lack of access. According to the district health teams, the approach allows large numbers of children to be reached at once, ensuring that no child is left behind, while also delivering additional services such as vitamin A supplementation, deworming, nutrition screening, and also the health education. The initiative also comes in response to the earlier resistance driven by the misinformation, while authorities are now strengthening community sensitization campaigns to rebuild the trust and also improve the vaccine intake in such underserved areas. Health experts emphasized that schools are a critical entry point, particularly for reaching children under 15, while also supporting programs like cervical cancer vaccination for young girls. With this integrated model gaining momentum, officials say that the focus remains extending and expanding coverage, improving girl child survival, and also ensuring every eligible child in Kayunga is fully protected against the preventable diseases. Now, that's what happened in Kayunga district. And moving on to our next story, Uganda malaria vaccine rollout shows promise ahead for the World Malaria Day coming soon. As the world marks the World Malaria Day on April 25th, 2025, Uganda is reporting encouraging progress in the fight against the malaria disease, with earlier results from the vaccination rollouts showing real impact. 1 year after the introduction of the malaria vaccine, health facilities across Uganda are recording fewer hospital admissions and also deaths among children under 5. One of the groups most vulnerable to the disease, health experts say that there is a growing trust among communities and is driving uptake, with parents increasingly embracing vaccination as a key tool to protecting their children. Community health workers have placed a crucial role on the ground, addressing the misinformation and guiding families through the immunization process. Uganda's progress also mirrors trends have also been seen in Kenya, where vaccination acceptance remains high in high-risk areas, and also in Cameroon, where early data shows a notable drop in child clinic visits following the vaccination introduction. So, despite malaria remaining a leading cause of illness and death, health officials say that the vaccine rollout marks a major step forward, offering renewed hope in the reducing the burden of the disease and saving young lives across the continent. Moving on to our next story, malaria cases surge in conflict zone amidst vaccination or vaccine misinformation. A sharp rise in the malaria cases is rising globally. A sharp rise in the measles cases is rising global concern, with new data showing infections increasing by over 25% in conflict-affected countries last year, driven by a weak health system, misinformation, and also reduced international aid. According to Save the Children organization, more than 74,000 cases were recorded across 18 conflict-hit countries in 2025, and accounting for nearly a third of the global measles infections, despite representing a much smaller share of the world's child population. The crisis is being fueled by a combination of factors, including the attacks on the health facilities, disrupted vaccine supply chains, and the growing mistrust in the immunization. Health experts warn that this misinformation is reversing years of progress, leaving more children unprotected against the disease that is most entirely preventable. In Sudan, ongoing conflict has severely weakened the system's health, with measles cases rising sharply and outbreaks becoming more frequent. Similarly, also Nigeria continues to struggle with high numbers of under-vaccinated children due to service disruptions and also persistent vaccine hesitancy. Despite the availability of the safe and effective vaccines that offers up to 97% of the protection, global immunization efforts have stalled in many regions, putting millions of children at risk in the country at large. As the World Health Organization marks the World Immunization Week, health agencies are now calling for urgent investment, stronger community engagement, and also renewed commitment from governments to restore vaccination programs and also prevent further loss of life. That's about the global news. Now, moving on to our other story. Women are the key to solving Uganda's nutrition crisis, experts say. Uganda is losing an estimated 1.9 billion people due to the persistent nutrition challenges, but experts say that the solution may already lie within the communities, particularly in the hands of women. According to Athaire Joyce of the African Women Agribusiness Network, women play a central role in the country's food systems, with nearly 75% actively involved in agriculture, from production to value addition and also promotion of the nutritious foods. She emphasized that despite this critical role, many women agro-business entrepreneurs may remain largely invisible and under-recognized, limiting their potential impact on tackling malnutrition, an issue that is rising in Uganda. Athaire urged the public to shift perspective and stop treating nutrition as emergency issues and also calling instead of a long-term sustainable solutions driven by those already working within the system. She also challenged the media to amplify the voices and also the work of women in agribusiness, noting that increasing their visibility could unlock the practical and also community-based solutions to the nutritional challenges we are facing as a country. So the initiative by AWAN organization aims to ensure women are not only active participants, but also recognized and supported as key drivers in improving food security and nutrition across Uganda. This is a call that is coming in to the country at large to give the women a chance to improve the causes that may be coming and leading to malnutrition. So those are our stories for today, and we are going to be moving on to our health expert moment. Let's take a short break and then we come back with more.